This video discusses the process of immunizing your child against disease. Immunization lessens the risk of your child contracting one of 12 serious diseases. This video includes information about the types of immunization and the diseases they help to protect against. Immunization protects your family from contracting serious disease. New Zealand has a national immunisation schedule with a breakdown of the immunisations given to children at varying ages. Immunisations are not dangerous and can be very effective at preventing disease. Immunisation for children is free and is administered by your doctor or nurse. The first immunisation starts at 6 weeks old. Injections are given on the upper arm or buttock. Each immunisation requires 2 or 3 injections. Immunisations are most effective when given at a specific age and time, following the National Immunisation Schedule. Immunisations are recorded on the immunisation certificate in your child's Well-Child Tamariki Ora My Health Book. They are also recorded on a national immunisation register. If you are uncertain whether or not your child has completed all their immunisations, please contact your doctor or nurse for clarification. The Ministry of Health encourages parents to immunise their children. However, immunisation is your choice. Please talk to your doctor or nurse if you have any questions. Immunisations work by way of administering a vaccine to the child via an injection. The vaccine assists the body's natural immune system by encouraging the body to develop antibodies to fight against contracting certain diseases. Doctors report instances of severe side effects, and the program is monitored for safety. Why immunize your child? Babies are usually born with some natural immunity to disease. Breastfed babies get additional antibodies from their mother's milk. This natural immunity only lasts a short while, and it can't protect your baby from all diseases. It's important that your baby or child is immunized at the recommended times to give them the best protection possible. Keeping track of immunizations. Start your child's immunizations when they are 6 weeks old for the best protection from disease. The National Immunisation Schedule is the timetable of recommended immunisations. It shows when your child should have each immunisation to get the best possible protection. It's important for your child to have all their immunisations. Take a look at the video section titled National Immunisation Schedule. It's important to try and immunise your child at the right time to give them the best possible protection. But if you're late, you can usually catch up. Keep in mind, you need to begin immunisations against rotavirus before your child is 15 weeks old. If you think your child might have missed one or some of their immunisations, talk to your family doctor or nurse. You will need to show the immunisation certificate of your child when they start at childcare services, kohanga reo, or primary school. Remember, immunisation is your choice. Please talk to your family doctor or nurse if you have any questions. The immunisation certificate details your child's immunisation history. You can request a copy to keep from your family doctor or nurse. New Zealand has a comprehensive national immunisation schedule. It includes the age for certain immunisations, the diseases they protect against, and the name of the vaccine given. In addition to the rotavirus vaccines, at 6 weeks old, your baby needs 2 injections. At 3 months old, your baby needs 2 more injections. At 5 months old, they require 2 more injections. At 15 months old, they need 3 injections. At 4 years old, your child requires 2 injections. And at 11 years old, your child requires 1 injection. At 12 years old, girls need an immunisation requiring 3 doses over a 6-month period. What serious diseases does immunisation protect against? Diphtheria. Diphtheria is a throat infection. It makes it hard to breathe or swallow. Diphtheria may also affect the nerves, muscles, and heart. Haemophilus influenza type B causes meningitis, which is an infection around the brain, and epiglottitis, which is swelling in the throat that blocks the breathing passages. It may also cause pneumonia and infection of the joints and under the skin. Hepatitis B. This attacks and damages the liver. It can make the sufferer feel sick and tired and turn their skin a yellow color. Human papillomavirus. This can cause cervical cancer and some other cancers. It is a virus that almost all adult New Zealanders are exposed to at some point. It can also cause genital warts. Measles. Measles causes a rash, a runny nose, coughing and sore, watery eyes. It may also cause pneumonia, ear infections and brain damage. Mumps. Causes swelling around the face, a fever and a headache. Mumps may cause swelling of the brain and deafness. Pneumococcal disease. Causes pneumonia, meningitis and blood poisoning. It may also cause sinus and ear infections. Polio. Polio can paralyze the body and make it hard to breathe. Rotavirus. Causes vomiting and diarrhea. This can lead to severe dehydration and sometimes death. Young babies are most at risk. Rubella. Causes a mild illness with a rash and joint pain. It is serious if a pregnant woman catches rubella early in her pregnancy. Her baby may be born with serious problems such as deafness, blindness, heart defects and brain damage. Tetanus. Causes muscles to stiffen and spasm and makes it extremely hard to breathe or swallow. Whooping cough. Damages the breathing tubes, causing coughing spells and vomiting. It may lead to permanent lung damage and can cause babies to stop breathing. Young babies are most at risk. Some babies and children may be offered additional immunizations if they are at high risk of disease. Your family doctor or nurse will discuss these with you. Reactions. It is common for babies and young children to have mild reactions after immunization. These reactions may last for up to 2 days. They can take the form of irritability, tiredness and crying, a mild fever, a small lump where the injection was given. Some babies may have mild vomiting and diarrhea. This may be for up to a week after receiving the rotavirus vaccine. What should you do if your child has a reaction? Don't rub the injection site because this may make the reaction worse. Loosen your child's clothing if they are hot. Give your child extra fluids to drink, for example water or more breast feeds. Only give your child paracetamol or ibuprofen if your doctor or nurse says to do so. If you're worried about your child's reaction to an immunization, talk to your doctor or nurse, or call the free Healthline service on 0800 611 116, any time, day or night. The National Immunization Register. The NIR holds the immunization details for all New Zealand children. Each time your child receives an immunization, your doctor or nurse will record it on the NIR. This helps make sure that your child gets the right immunizations at the right time. You'll be sent a reminder when each immunization is due. Your midwife or doctor will tell you more about the NIR before your baby is born and when they talk with you about immunizations. What is on the NIR? The NIR records the following details about your child: their name, home address, date of birth, sex and ethnicity. Their unique health number, or National Health Index, or NHI. Their family doctor, nurse, and Well Child Tamariki Ora provider. Their local district health board. The immunizations that they have been given. And finally, your contact details. The NIR will also record if you have decided not to have your child immunized. Who can see what's on the NIR? Only authorized healthcare providers can see your child's details on the NIR. The information is there to make sure your child gets the free immunizations they're entitled to. You can ask your family doctor or nurse for a copy of the information held on the NIR about your child at any time. Choosing not to have your child's immunization details recorded on the NIR. If you don't want your child's immunization details to be recorded on the NIR, you can complete an opt-off form. Ask a doctor or nurse for the form. Your child can still have free immunizations up to the age of 18 years, even if you have decided not to have their immunization details recorded on the NIR. The NIR will still hold your child's name, date of birth, NHI number, and local DHB.